Hey, how's it going? This is Saman here from All Things PT, and welcome to the second part of lower back pain series. If you haven't watched my first part, then that video is all about what exercises you do when you have a 10 out of 10 lower back pain. But in this video, I'm going to cover the progress. So we're going to go and upgrade. So you have done that for a few days, your pain is getting better, and you want to even improve it more, okay? If you have 10 out of 10 pain, this video is not going to be for you because it will just increase the pain because your body is not ready, right? You need to learn ABCDs before you write an essay, so you need to get the basic right. So if you do have a lot of pain, go back to my first video and then follow those exercises, and once the pain is manageable, then you come down. And this is going to be in the between, and I have one more exercise, one more video that's coming up that's specifically that you need to do for maintenance so that you'll never have lower back pain, or your possibility or your chances of having lower back pain is significantly less, okay? So please make sure you subscribe to the channel. But anyways, before without wasting any time, let's go on our back. And everything starts when it comes to lower back pain, it starts with breathing. First of all, you're going to maintain what you call a neutral spine. So to do that, what you want to do is lie down on your back just like I am, and you are going to make a tunnel right here as high as you can, okay? So that is your maximum, what you call the anterior pelvic tilt. Now, if it hurts you, don't even try that. I'm just giving you a cue. And then go to the opposite direction where your lower back is really flushed against the mat. Okay, that's what you call your extreme posterior pelvic tilt. Your neutral pelvic spine is somewhere in the middle. Okay, that's a very crucial element here of all the exercise, honestly. And you put one hand in underneath, and there should be just a little bit hole, right, in your spine. And your goal with all the exercise is to maintain that. So what I mean by that is, as you start moving, this space should nor increase or decrease. So try to maintain that space right there. Okay, let's start with a few breathing techniques just to warm up your abdominal. So you're going to put one hand on the chest, one hand on the stomach. Breathe in through your nose and out through your mouth. And as you breathe, pull that belly button in towards your spine. Your key is to maintain that arch in your lower back. Okay, so don't do anything like this, okay, where you are crushing against. Don't do anything like that. So maintain that. So breathe in again and out. Pull your belly button towards your spine. Make sure that arch is not changed, and hold for a few seconds. Do that a few times to activate your core. After that, what you're going to do is you are going to do what you call a low trunk rotation, but we are going to do a little variation. Now, you have seen people do something like this and twist their back and stuff like that, and that's kind of the movement that is kind of looks somewhat similar, but the purpose is different. We are going to go through the ranges, but we are going to control it with your abdominals. So what you're going to do, again, make sure you maintain that neutral spine and best of your ability. Pull that belly button towards your spine and rock. You should feel the stretch, but the thing is, you should keep that core tight and belly button towards your spine as much as possible, okay? And then as you come, hold for a second or two, and as you bring it back, you should use your abdominals to pull it to the other side. Okay, if you can talk, you are breathing, that's good. Don't hold your breath. Okay, so this way, pull with the abdominals. And go all the way this way, just as much as you can without hurting. Keep your abdominal engaged. Pull. Go. And pull. You should really be feeling your obliques firing up. Okay, this way. And pull. And pull. Now, if going all the way here hurts, just control that range. Just go up to somewhere here if that's what you can do. Okay, if you can do that, that's fine. The same thing, if you can only go to this much, that's fine. The key is pull that down. Use those to bring it up. Again, this side. Okay? So that's one exercise. And you're going to do that 2 sets of 10. You can start with 1 set of 10, but 2 sets of 10. Next stretch, we are going to do what you call a piriformis stretch. And then you are just going to pull this, right, your knee towards the opposite shoulders. So here, and like that, you should be feeling a little stretch. If this is too easy, and if you feel like you can go for a little stretch without hurting yourself, again, that's the key. You shouldn't be stretching painfully, okay? So you can hold that for 30 seconds. Obviously, you do that on the other side as well. That, pull. What we don't want is something like this where the whole back moves, okay? Your back needs to be on the ground, and you should be pulling this side to my left knee to the right shoulder. And if you can, actually put your left hand on your hip, and with the sit bones right here, try to push on that hand down that way while you pull the knee. So this is going to create more stretch if you have a hard time feeling stretch just with the pull. Okay, so you can pushing the sit bone that way, and then you're pulling the knee this way. Okay, and hold for 30 seconds, and you will do the same thing the opposite side where you push this now. Okay, and you're going to push that in this angle right there. This knee comes here, hold for 30 seconds, and that's actually should feel really good. Again, if it hurts, you don't absolutely need to do all of these. And if this is too easy, even after the stretch, what you can do, you can put both of these and then pull the whole leg up. Or you could do like this, where you're lifting the leg up, okay, this, and now you are pulling the left knee towards the chest. And that's also a variation, just like that. Hold for 30 seconds. I like this much more than this because I feel like I can get more control, because I can use both hands to control. And one thing I kind of forgot to mention is that the thing about the neutral spine doesn't really change. So you shouldn't be arching your back like that. Try to maintain that spine the best of your ability. Okay, so hold for 30 seconds. And this way, pull, and again, hold for 30 seconds. Okay, so this is either or. So you can either do this stretch, and if that's too easy, and only if you can do this without any pain, go ahead and do that. It's a little advanced, but I just wanted to give you guys a few options like that. Hold 2 sets of 30 seconds each side. Okay, now we are going to work on the butt muscle. What you're going to do, you're going to keep your leg about, it should be somewhere around where you can touch, you're barely not touching, I should say, your heels. Now you can put your hands on the side, or you can put your hands on the chest, doesn't really matter. Where you put, squeeze your shoulder blades together. A lot of people forget that. Again, make sure your pelvis is neutral. And then all you're going to do is squeeze the glutes and be in that position. Squeeze your glutes as hard as you can. Hold for 5 seconds. That's the key. And slow on the way down. Okay, squeeze the glutes. Hold for a few seconds. Okay, and down. Now, What you can also do, so getting a little bit more technical, is you can, with the heels, push on the floor first, okay, and then squeeze and up. And sometimes that will be easier on the back. The only thing that's completely incorrect, okay, there's always different ways to do different things, but the only way on this one is incorrect if you use your back and arch your back like this. Right now, I'm not squeezing my glutes. Okay, I'm just arching my back and I can really feel my back. So if this exercise hurts your back, then that means you're not using your glutes well. And what you could do, you can just squeeze your glutes as hard as you can, and you don't even have to come all the way up like this. Okay, so even if you can come in just up to here and squeeze that glutes, that's fine. Okay, but try to squeeze your glutes as hard as you can. That's the gist of the whole exercise. And hold for a few seconds and relax. Okay, so you're going to do that 2 sets of 10 repetitions. So what did we do till now? We did a couple of breathing warm-ups, right? We did this one, right? We did the stretches, right? So this one or this one, right? We did the bridge, right? So that's 3 exercise. And now what you're going to do is you're going to work the adductors muscles. So you got to do what you call the clam shells. I'm going to be in this position. So again, people like to be very specific with those, but for me, just be in a position that you're comfortable in. Don't round your back like this. So make sure your back is still in a neutral position right here. And what you're going to do, you're just going to lift this knee up. What a lot of people will do is they will do that and they'll start twisting like that. And that's not the exercise. We're not trying to twist anything right here. So here, you can put your hand on top to give it a little resistance if you need to. But the muscle that you should be focusing is on the side butt, the gluteus medius. Okay, so from here to up. Again, keep your pelvis, don't twist, so only up to here and down. Here, squeeze your butt, and you can play around with the position a little bit to see what's comfortable to you. The key principle is not twisting and initiating the movement with the hip. Okay, don't twist your back. And if that's too easy, you can put your hand to give it just a gentle pressure, and you can go up. Hand, and on the way back, push down with the hand, and let the hip win, but resist. Up, let the hip win, but resist. Let the hip win, but resist. Okay, so you're going to load a little eccentric motion if just going like that is easy. Okay, and you're going to do that. The hands, I can feel it. Now, if this is too easy, you can always upgrade to the side lying hip abduction, like that. So the key a lot of people will do, let me show you how people do it incorrectly first. So this is straight, right? And a lot of people will bring this forward and do this kind of thing and see how high I can go. Okay, that's because I'm using my psoas and the hip flexors and the other stuff. If you want to work this glute med properly, hold on a second. Okay, if you want to use the glute med properly, you should go back like this. Okay, it should be at least in line with the body or behind the body. And you see how I can't go very high? That means I'm using the right muscles right here. Squeeze your butt as hard as you can and down. Squeeze your butt as hard as you can. Hold for a second or two and down. Okay? So either this, and you can always start with this, and as this gets easier, go back and do that. Okay? And that. And now the final exercise to be planks. Okay. Now, we're not trying to go do a full-blown plank. Depending on your level, you can just go on the knees like that, or you can actually even go on your all fours and pull your stomach down. Stomach in towards your belly button in towards your spine, and you can just be here, and maybe that is what you can tolerate, and that's perfectly fine for right now. Okay, I'm still on my hands and knees. Even this activates a lot of core, especially if you keep the abdominals pulling. You can go here like this, and that's more challenging, but the thing is, you have to remember you're not doing something like this. You need to make sure that your back is kind of neutral. It starts to be easy. You can always go and do the modified elbow planks. Okay, so be right here, hold for 30 seconds, pull that belly button in. Again, you don't want the back to be in this position like that. This, but definitely not this position. Okay, so pull that belly button up, hold for 30 seconds, and if this is too easy, do that. Squeeze your butt, and that's the important part that comes in now. If you want to do a full plank, okay, try your best to maintain the neutral spine. Absolutely not this type of thing. Okay, so here, hold for, you can start even with a 15-second, and down. Okay, so what did we do? Let's recap again. Okay, we warmed up with the breathing. You can do that about 10 times. Make sure your spine is neutral. After that, we did the side to side while using the obliques to pull, slow and controlled, 2 sets of 10. Then we did the stretch, so you could either do this, hold 2 sets of 30 seconds, or you can do that, 2 sets of 30 seconds. Okay, and then what did we do? We did this, right? Right, where we, oh sorry, we did the bridge, forgot about that. We did the bridge, 2 sets of 10 seconds, 2 sets of 10 repetitions. Okay, make sure, don't rush like me, I guess. Here, squeeze, right? Squeeze, 2 sets of 10. Then we're working our glute med with either clamshell. Make sure you don't twist with the spine. Just focus on this. You can do that, or you can put your hands to give it a little eccentric action, or you can do that. Side lying hip abduction. Hold for a few seconds, 2 sets of 10, right? Remember, don't do this here, back and forth. Finally, we are ending with the plank. So you can either go on this position right here, like that. Pull your belly button in. Try your best to get that neutral spine. It shouldn't be painful. That's the main key. Or you can go on your elbows, or you can go like this. Squeeze your butt. Hold. Okay. None of these exercises should be painful. That's the key here. If it is, just back off. Back off. There's no shame in backing off. Okay. I hope this video helped. There's one more part coming in, and it's going to be more of advanced stuff. I hope you liked this video. If it did, make sure you click the like button and make sure you subscribe, because more videos on physical therapy coming soon. Okay. All right. Sure. Bye bye.